are we?
I will tell you, I got off a cruise the week that they isolated the ship, the cruise ship. So it was the same week.
Mm.
We can talk about that one.
All right, Dr. Cole, sorry for the delay, but we are all set, and you're ready to call the meeting to order whenever you're ready.
Fantastic. Hope everybody can hear me. I'm new to Zoom myself, so we'll do our best today to try to get through this. So let's call this meeting to order. Today's date's May the 28th, 2020. So this is our Ohio County Board of Health meeting. And want to start out by acknowledging that we do have a quorum. I see, what we got on here now, 12, about 15 on, looks like.
Yes, we have
We definitely have quorum.
members, so all but one.
All but one, fantastic. So it's good to see everybody. And first item on our agenda is to approve the minutes from last year's May the 10th, 2019 meeting. If everybody got the packet that Clayton emailed to us, you should have that. And I hope everybody's had a chance to look over that.
Sorry.
It's all right. Does anybody have any questions on the minutes or comments on the minutes from last year's meeting? Nope. Does anybody have corrections to last year's meeting? Minutes? Nope. So if no corrections or comments, the floor is open for a motion to accept those minutes as written.
Make a motion to accept it.
Okay, I can't tell who that was. Raise a hand so whoever's keeping the minutes from this meeting will know who spoke. So Brother Armstrong made a motion to accept those minutes as written. Do I have a second?
Second.
Okay, Athena, I saw Athena's hand go up first, so I think Athena seconded that. All in favor of accepting those, raise your right hand. Okay, looks like about everybody. Any dissension? Raise your left hand. No, okay, good. So the minutes pass as written. Laura, is Laura on here somewhere? There she is. Hi, Laura. Laura, do you have a building update for us?
We've just had a few things that we had done this past year. We did wind up having to get a new dishwasher for the kitchen. And about a week or two ago, we did have to get a new hot water heater installed. We were having a leak. Other than that, I think we're pretty good.
Okay. Building's in good shape. I think our inspection last year said it was in good shape. So, okay. Any questions or comments on the status of our building? Nope. Okay. Next item on the agenda is our public health director's report. And so obviously everybody here in this group, I'm sure, heard a boatload about COVID-19. And I think, Clay, you're going to tell us some more today, right?
I am. Thank you for everyone for joining us and being on the Zoom call. I know it's a little different than what we normally do. But you know, the health department for the last 10 weeks, maybe even longer than that, actually, have been all COVID-19 all the time. It's been our primary focus, and so it's changed a lot of what we do at the health department. We are really kind of in a position of recovery now, even though we think that the hard work is still ahead of us. But we're focused on working with our community partners as people reopen. We are ramping up our contact tracing. We have a new regional team that started today, in fact, that are been sent to us from. They're all new employees. They've been hired through a program that we partnered with the Kentucky Department for Public Health for, but they're stationed and located here in our health departments. We also have the ability to hire additional contact tracers, and we'll be doing that in the coming week. So working through that process and looking at candidates and trying to figure out where we are going. So as a district, as of this morning, we have investigated 656 laboratory confirmed cases of COVID-19 for Ohio County. It's 165 cases of activity in Ohio County the last 3 or 4 weeks. It's really kind of been a big focus of our attention in terms of the number of cases that we're working and having to follow up and do contact tracing. So the good news is the majority of our cases have been released from isolation. They've recovered from the disease. We continue to think that we're going to see cases as things open up. But one thing that we've learned from this exercise and from working with various businesses is that it is possible to operate in this environment without having uncontrolled spread. We have seen that. We've seen that over the last couple of months. We saw businesses that that some of them were even proactive and leaning forward and getting ready for COVID-19, but they maybe underestimated how hard it would be to control. But with the right type of infection control, training, the right type of processes that you incorporate into your work, we've seen a lot of success stories. We've seen some others that are continuing to struggle and continuing to have cases. But what we do know is it's possible. And so that's really kind of our mission and our goal as things are reopening, is to do that education, work with partners, continue the contact tracing and our containment, but really kind of get things moving again. So this slide, if I can get things moving here. This is our epidemic curve for our district. This is showing a number of cases that we've had reported based on the date of onset of symptoms. So you can, with the exception of the spike that you can see, I don't know how to use the pointer on this, but there's a spike on May 6th. That was the mass testing at Purdue and the large number of asymptomatic positives that we had. But with the exception of that one day, we're seeing a downward trend. We have seen, fewer cases than we were through April. And, at this pace, we feel well prepared and well within our capacity to continue to respond.
Now, these tests, are they by county of residence? You mentioned Purdue, and a lot of those people do not live in a county. So they would not show up on the graph.
County of residence, yes. So these were folks, primarily our cases for Purdue were in Ohio County. We did have some in McLean and Davis County as well. I think when I looked at it this morning, Purdue accounted for 96 of our cases out of the 656 in the district. That outbreak as a whole, if you're looking at counties outside of our jurisdiction, it's closer to 300 is where we are. So just kind of demographic breakdown. Early on, March, early April, we were typically seeing folks in their 50s is our typical case. But with as we've kind of moved on, our epidemiological picture has really kind of shifted to places that are still open, still were working. We saw a lot of working age folks. We had major outbreaks at Purdue, Tyson, Specialty Foods, and then a few other smaller clusters. But that really pushed our average case down, the average age of our case down to 43. It really did kind of change the picture in terms of who we were talking to and the typical COVID patient. And like I was saying earlier, what we're really focused on now is the Healthy at Work. That is our main communication strategy. We have a lot of our employees, we've kind of reassigned our entire workforce to different tasks during this whole process. Most of our nurses are doing case investigations at this point and contact tracing. As we're able to stand up these new teams and get new people on board, we'll be transitioning a lot of those duties back to our clinical services, which a lot of we've moved to telehealth services, the ones that we can. Our home visiting services have been moved to a telehealth model. Our health education department, a lot of our folks that are normally out doing advocacy on issues like tobacco and physical education have been helping with working as a liaison from the health department to employers, especially employers that have had confirmed cases. And now they're doing a lot of work, and I guess really consulting would be the right word, employers as they prepare to reopen and looking at the plans and the practices that they're putting into place.
Started 120. How do you feel about giving her some fluids? Did you see her BUN and creatinine and stuff?
I went ahead and muted that. So, so we're moving ahead. We are have started doing weekly testing, kind of a low barrier, low screening, anyone that wants to get tested for COVID-19. This week in Ohio County, or this week we completed in Ohio County, we did a remote site over in Fordsville Elementary. Next week, we're going to continue that with a mobile site at Western Elementary. It's a very busy time here, I just want to say that I'm very proud of the team, proud of our employees in all of our counties. Folks have stepped up. They've done things that they're not comfortable normally doing. They've learned new jobs, and they've really risen to the occasion. So as a board, I think you should know that the people that we have on staff were up for the task. They're going to continue to be up for the task. And as an administrator, I couldn't have been prouder for the folks that we had here. Lots of long days, long nights, people working, 7 days a week at some point or another, because the cases come in, all of the time. Haven't heard any complaints, and people have just done an outstanding job.
Clay,
Yes, ma'am.
when did the health department start doing the testing? I wasn't sure when that started.
So we started doing the testing out of our health centers, I believe, 3 weeks ago. We had done, the history of that is initially we weren't set up with with a vendor or have the lab capacity to do the testing. Kroger came and did a mobile drive-through testing at the Owensboro Community College several weeks ago. There had been a desire and a request from several in the community that they extend that a second week, and Kroger wasn't able to support that. So Kentucky Department for Public Health contacted us and offered to leave the equipment if we staff it and run it and they would provide the lab capacity at that point. We agreed to do that for 1 more week, and then we asked for ongoing ability to continue with the program and then move that to all 7 counties. So I think this was our 3rd week of testing out of either our mobile sites or our health centers in all counties.
Okay, I was just asking because we were trying to make sure that we were publicizing where all the test sites were, and I just wanted to make sure we didn't miss you guys without knowing it. So.
Yeah, so this upcoming week will be at Western Elementary School. Laura, correct me if I'm wrong, I believe that's on Tuesday next week.
Yes, that's on Tuesday.
And then, we'll look at other additional remote sites, or we may go back to the health center in Hartford. But unless there are other questions, Dr. Cole, that's all I have for our status update and check-in.
Okay. Anybody have any particular questions of Clay in regards to this, or myself or the other clinicians? Okay. Good. Next, then we'll move on to the community access project, our prescription assistance program. And let's see, Suzanne, she's got the report on that today, or who's got that?
I do. Thank you. I'm going to share a screen with you guys. I need, if you'd enable it for me, Clay.
It looks
I'm
like
not even seeing her on the screen. There she is. There you are, Susan. And everybody got the packet, I hope, in the handout that was emailed out to us.
Clay, it says host disabled.
Okay, I'm correcting that now.
Thank you so much.
I believe you should be good to go.
Thank you. I got it now. Okay, can everyone see this?
Yes.
Yes.
Great. I thank you guys. I'm glad to see everyone's able to attend the meeting healthy, and appreciate your all service. I want to start with a patient letter, which I think is at the heart of why you all believe in the project, that it impacts Ohio County residents. But this particular patient said, "Dear Community Access Project, I want to thank you for helping my husband during the last year before his passing. Your efforts reduced the stress off of us during a hard time." So we helped that patient get a little more than $5,000 worth of medications. And so what we find is that sometimes our patients don't, sometimes they die even in our project, but we still have family members who write to us and say, you helped make his quality of life better. And so we still see that as a win when we can relieve people during really hard times during their health crisis. As most of you recall, I won't waste a lot of your time, but we're all about access to care. We're helping people get prescriptions assistance through pharmaceutical companies. We're having them to sign up. We're helping them sign up for Medicaid and other insurance. We're helping seniors sign up for low-income subsidies. We're doing all kinds of resources. And any given day, in terms of referrals to other community resources, it's numerous, thousands within a year that's going on in terms of just to help make the links of access to care. And so I'm really proud to be reporting to you guys that for 2019 was a program record, that I didn't even know that it was possible in Ohio County to get a little more than $1.3 million worth of prescriptions for folks. And so those were absolutely free to the citizens of Ohio County. And so we helped 512 patients. In terms of medical providers, we worked with 152 to do that. And just to remind you, some of the most common diagnoses are diabetes, asthma, heart-related diseases, and so many more. So any medicine that you can think of that you take or your neighbor takes or a family member takes, we're probably getting it through a pharmaceutical application program. But it's really cumbersome, detailed. It's a lot of coordination. And so the medical community really has appreciated our effort in helping them with that and navigating that, and obviously the patients as well. Just to let you know, from this year, we're already on a pace from January to April, they were already on a pace for little more than $700,000, so $760,000. So that tells me that we'll probably, if this continues, have another record year. So I really appreciate Annette Johnson is the one that works in this project, and she's been with me, I think, about 6 years, and she's doing a phenomenal job of really caring about the citizens of Ohio County. Big picture, I remember the day I went and talked to this board about we could do some things for Ohio County, and I really didn't know at that time that we were going to be able to do $6.8 million worth of free meds for Ohio County people, and I'm really proud of that, and I thank you all for believing in us. Right now during the pandemic, there are many people who are laid off and have needed our services for the first time, and also there's offered the Medicaid has offered a temporary medical card for folks that are laid off due to COVID, and we've been able to help get 50 people in the last 2 months in Ohio County signed up for a temporary medical card to kind of help them along with medicines. So we're really just caring about the access to care. Any questions so far? Okay, I'll move on to the graph. I know these numbers are a little small, but you see the 1.3 million that I mentioned, and then last year a little more than $900,000. So you see the increase and how it's a record year, and so we're very proud of that. In terms of, I mentioned the Medicaid applications. We've done 459 Medicaid applications. So that means someone came to us and said, hey, I don't have any health coverage. And so on the spot, Annette helped sign them up for Medicaid that they qualified for. And then, as I mentioned to you, an additional 50 presumptive eligibility, which is that temporary medical card. And in terms of overall, since Affordable Care Act started, we're at 1,983 Medicaid applications for Ohio County folks. In terms of this year, we've signed up, we've learned that a lot of seniors qualify for low income subsidy, which can kind of help with their medication costs, and they don't even know that they qualify. So we have a dozen seniors that were going without for no reason at all. They just didn't know they qualified. So we've helped sign up. So that's something we kind of stumbled into. And we're glad to keep doing things that increase access. In terms of return on investment, for every dollar entered into this project, with your all's generosity, $27.47 is returned back to the community. So every patient on average that we interact with are walking away with $2,682.94 in value. Of course, that's an average. Some walk away with much, much more and some less. It just depends on the price of the medication and what we do for them. But I know on average that patients are on 6 medications when they come to us, often needing help with. And so that there's a great need. That you all continue to support us. We couldn't have done this without you 100%. And so we want to continue this mission so that we keep program costs at bare bones. It's really just paying for case management. We're careful on supplies and almost every other aspect. So I ask for you all to continue to support us as you have in years past with the 50,000. And so that's really all today. I do thank you all, and I'm open for any questions you might have.
Susanna, as always, I've got a couple of comments on this program. As you've heard me say now for several years, I am 110% in support of this program. This is money well spent, and it's a cost savings on the back end. Letting diseases go untreated and uncontrolled is clearly associated with increased costs down the road. So this is good preventative medicine that saves us money. On the low-income subsidy for the geriatrics, are you guys getting any referrals directly from home health services and home health agencies on this?
No, we're really, once people come to us for prescription assistance, we look at their documentation, and we then, it's not something we're necessarily broadcasting as a major service, but we just, when we're with someone who's asking for prescription assistance, we kind of look at the whole package and their documents and say, you know, your income's low enough, I think you would qualify. And so it's really an online service portal. And so we literally help them on the spot do that online.
I just wonder, because this comes up a lot through home health, when they go out to assess some of these geriatric patients, they'll come across this need. And I've had several of them, report to me that, hey, we've got this patient, we think they may qualify. But on my end, I'm sort of deficient of knowledge of how to help them. So
I'm happy if you need somebody to, it's a really low income subsidy is probably one of the more easy services that we do. So we're happy to help with that. The only obstacle is we don't know right away. It will not give you, tell you on the screen that the patient will get a letter. So sometimes there's a little lag in between, like applying. And
a couple of the agencies have a social worker that is doing that and helping them as well, but a couple don't. So I'm going to start steering them your direction.
Absolutely.
Hope that's okay.
Yeah, absolutely.
Any other comments or questions of Suzanne on this issue? All right, Suzanne, thank you very much.
Thank you.
Next is our financial update and the budget review for 2020. And Laurie, you got Laurie on here somewhere?
Yep, I'm here.
There you are.
Excuse me.
This is a busy screen with lots of small boxes, and so.
Yeah, I bet. So in your packet, you've got the Howe County Taxing District Treasurer Report. So if you guys want to refer to that. We started the year July 1st of 2019 with $712,853. For the first 3 quarters of the year, in real and personal property taxes, we've received $378,704. Motor vehicle tax, $43,497.70. Delinquent tax, $43,2035. Telecommunications tax, $2,181.67. And we've earned a little over $1,100 in interest income, making our total revenue received $429,809.29.
Okay.
Expense-wise, we paid the first half of the tax appropriation payment to the district at $229,796.50. and that second payment will be made in early June. Building maintenance and repair, as Laura said, there hasn't been a whole lot of activity on the building this year, so we've only spent $2,640.42. We did complete the financial audit for $2,000. The financial statement publication at $71. And the SPGE annual fees were paid last July of $250. And so far in CAP, we've spent $18,676.05. The remaining amount to bill out for the services, the administrative services, will be $24,023.95. So overall, we've spent $253,433.97, making the current cash balance $889,228.28. Projecting for that last quarter, excuse me, we're projecting to bring in about $143,270 additional revenue, and total expense, additional expense for that quarter would be $254,770, almost $771. So overall, our projection to end June 30, 2020 would make our projected end balance of $777,727.45. Does anybody have any questions over the financial report? Okay, so I included in your packet as based on discussion last year, you wanted a financial review of previous years. So I did a 5-year financial review of what your tax rate was, how much tax revenue has brought in, and interest income, and then
Thank you for doing that, Laurie.
You're welcome. And what our overall expenses were. And if you guys look at that, since fiscal year 16 through the projected ending on June of 2020, you can see our ending balance is held pretty steady. We'll end a little bit more, a little better than what we were June of 2019. So overall, the financial sustainability of the district is very, very, very healthy.
And for those who don't remember, we had to effect a tax rate increase, and we did it in 2 steps since 2016, and that really looks like turned the numbers around. And we should stay, if I remember right, we should stay to the positive for several years before we ever begin a decline again.
Yeah, that is correct.
So hallelujah. All right.
Does anybody have any questions or comments? Okay.
Nope. No further comments on financial update or the proposed budget. Okay. So that leads us directly into the discussion about the current taxation rate. And I got a feeling, Clay, this will be an easy, short discussion.
It will be, but before we move on to that, we would need to have a motion and a vote to accept the financial projection, please.
Oh, actually, yeah, I guess we need to do that in 2 steps according to our agenda. So we'll start out motions, or the floor is open for a motion to accept the financial update. We'll do that part first.
I got Lance.
Lance has made that motion. Fantastic. Any second?
Mallory.
And Dr. Roberts has made the second on that. Thank you. All in favor of accepting that financial update as written, please raise your right hand. Okay, great. Any opposed? Okay, great. So that passes. Next is then floor is open for a motion to accept the proposed budget that she just went over with us.
Yeah, she went over the current year, and now she's going to give you the budget starting in July.
I thought that's what she just went over.
I went over fiscal year 20's financial report.
And I'm not seeing the budget. No, there it is. I'm sorry. Yeah, so bear with me. There you go. Thank you for whoever put that up. Yeah, so that's where we are now. So Laura, you want to go over that with us?
I sure will. So I left the tax rate the same. which is 4.5, with your optional tax revenue being exempt. We would, as I previously stated, we would start the July fiscal year with a balance of $777,727. Real and personal property taxes. The real property taxes would be $348,866. Personal property taxes, $85,700. Motor vehicles, $63,350, with an estimated $10,000 in delinquent tax. Telecommunications, $3,000, and interest income, $1,700, would make our total funds available for next fiscal year $1,289,810. If you get down to expenses, appropriation payments to the health department would total $457,976. I left the building maintenance and repair budget at $50,000. We would again have a financial audit because that is annually, and that would be at $2,000. The SPGE fees are annual, again in July at $250. Financial statement publication, $100. Potential bank charges of $70, and I left the CAP initiative budget at $50,000. That would make our total expenditures of $560,396, and our June 30, 2021 projected ending balance of $729,414. Questions?
Anybody have any questions on that? I mean, I understand this is just a budget. I think it's a little odd having the 50,000 still in for building maintenance and repairs. That's a thing I notice. It kind of happens every year, and we got really lucky, it sounds like, for a couple of years and haven't had to spend much. And of course, by having it on the budget doesn't mean you have to spend it. But
yeah, and we leave that in there in case there's any major problems with the buildings.
Yeah.
You know, if
you know,
have
the other
any-
thing that it does, at the end of the year, when you spend less than what you budgeted for, makes everybody look good.
Yeah, I always budget conservatively as far as worst case scenarios. And
Okay.
then, like you said, when we finish better, you guys are usually pretty happy about that.
So, any further questions or comments on this proposed budget?
Chairman, I make a motion, we approve it.
Yes, sir. And do I have a second?
Lance?
And Lance has seconded that. So I think that's now ready for a vote. All in favor, say aye with your right hand. Since can't hear everybody at once, okay. Looks like that was unanimous. Any opposed? No, good. All right. Now, Clay, this next item on the agenda for taxation rate, to me, that's kind of built into this last issue. If we accepted a budget at a 4.5%, then to me, that's almost an automatic that we've got a 4.5% taxation rate. Do we need a separate vote on that, though?
We do need a separate vote, and then we actually need two separate votes. We need one for the tax rate and one to exempt the optional taxes, which are commercial watercraft, aircraft, in-transit inventory, and Glory. I feel like I'm leaving one off, but you've typically exempted those items. Our proposal is just keeping everything the same.
Okay. So let's make this easy. Is there any motions to accept everything and keep it the same as Clay just stated, including the 4.5% tax rate with everything else being exempt? Athena has made that motion. I think that's a great idea. Is there a second? Judge Johnston has seconded that. Thank you. All in favor, please signify aye by raising your right hand. All right. Is there any opposition with a nay? No opposition. That passes unanimously. Let's see.
You all may recall that normally at this point I would pass around a tax resolution for everyone to sign. You'll be receiving that via email. It'll be a DocuSign document. You'll just log in, review the document, and it'll point to where to indicate that you have approved. But it'll be, I'll write it up just for what you all just voted on.
So you'll send that in a separate email, you said, after this meeting?
Yes, sir.
Okay, thank you.
I'll try to do it today. I haven't done this yet. So if all goes well, it'll be today. If I have technical difficulties, it may be tomorrow morning.
No, no problem. No problem. So next item on the agenda then, I guess we're talking about Board of Health representatives. And so help me on this. What do we need to do on this, Clay?
So your current representatives, your board elects representatives to the district board, which is the governing.
Oh, I'm sorry. This is go to the district. Okay.
For the health department. And so currently the judge executive has a seat, but he has designated Bob Cox to serve in that role. And then the board elects 2 other members of your board to represent you on the district board. And those have been Glenn Armstrong and Lance Smith.
Bob's not with us today, but Lance and Brother Armstrong, have you guys enjoyed that?
Yeah, I actually really do enjoy it. And it does tie in quite a bit with some of the things that I'm involved with here in my work at the hospital. So I'd be happy to keep doing it unless somebody else wants to give it a shot.
Right.
They
That
feed
sounds
us
great.
real good.
How about you, Brother Armstrong?
So they feed us real good.
They feed you real good.
You're not supposed to tell them that.
Yes, I'd be willing to continue.
That's why Bob's on the board, right?
That's true.
That's it. All right. I'll tell you, it sounds to me like we got 3 great representatives helping out and serving there. And if you guys are willing to do that again, I think that sounds like a good idea. Does everybody else agree? Yeah.
Anybody wants to?
Do we need to have a formal vote on this issue, Clay?
It probably would help.
Okay. Does anybody want to make a motion that we continue with our representatives as is, assuming Bob Cox wants to go along with that too?
See Dr. Wilson
Second.
Second.
and then Dr. Gregory.
Okay. All in favor? Raise that right hand. Okay. Any opposition? No opposition. That's excellent. Is there any other business or new business to discuss that we've not talked about already? No.
Mr. Chairman, before we adjourn, I'd like to say how much I appreciate the nurses and all of the staff of both our county board and district board who have been on the front line during the pandemic, and in some cases, maybe doing some things that might be a bit dangerous to their own health. And so I appreciate their sacrifice.
Thank you very much, Brother Armstrong. That's very nice of you to acknowledge those folks. And a lot of these nursing staff that are, in the hospitals, in these units that are really, really our frontline folks, man, the work burden and obligation they've taken on is tremendous. And so thank you for recognizing those folks.
Discharge, straight oxycodone. Which strengths do you all?
So is that somebody or background noise? That must be background noise I'm hearing. All right, Clay, did you have anything else?
No, I just want to say thank you to all of the board members for joining us today. Thanks for being flexible and doing this via Zoom. At some point, we hope that we'll all get back together in person again. But in the meantime, this is a good substitute. Keep your eyes open for that email. It is important that we get everyone that attended the meeting to sign off on that resolution that you voted for. And if you have any technical issues, please give me a call or give one of the folks at the health department a call, and we'll be happy to provide some assistance there.
All right, so let's talk about our next meeting then. When's that going to be?
Typically, we meet in April or May. We will probably plan on a spring meeting of late April, early May of 2021. We'll probably try to give you 3 or 4 weeks in advance notice. We didn't quite have that this time. COVID-19 kind of disrupted our plans. We had to kind of figure out how to make this happen at the last moment. So if that's
now,
okay.
here's your big challenge for the next meeting in person. We lost a wonderful lady in our community, Frances Southard. And how many meals did she provide for all of us? I certainly miss that lady. So we got to figure out how to get some good food.
We've got a plan in place.
Somebody's got a plan in place. Brother Armstrong and I will look forward to that.
Thank you.
All right. I guess the floor is open for a meeting or for a motion to adjourn this particular meeting then.
Move we adjourn.
Dr. Roberts?
And a motion by Dr. Roberts and a second from, was that Athena I saw? All right, so the meeting is adjourned. Y'all have a great day.
Thank you all. Thanks for joining us.